So headaches, very, very common problem. So very useful to know because your friend's going to have it. You're going to see it in the clinical situations. You're going to see it on step one. So there's a lot of different causes of headaches. The most common three we're going to cover, and one of them is migraines. So migraines are usually unilateral. That means you feel that pain on one side of your head. So Mr. Lincoln here is going to have a migraine headache. He's going to feel pain right there, all on one side of the head. And the duration of these headaches are basically 4 to 72 hours. So the max they'll last is usually up to 3 days. Now the quality of the headache, which is very telling, is this is a pulsating type of headache, so it's like throbbing. And you can see a migraine aura. So the aura is what you can see in this picture here. So that's an example of an aura. So that's what, instead of seeing that nice background, they're going to see this visual like brightness in their visual field. And then next you have photo and phonophobia. What does that mean? Phobia of the photo of light. So that means light causes them sensitivity, makes their head worse. Phono is sound, so sound makes their headache worse. The way you treat this is there's two things. You want to abort the headaches and you want to prophylax the headaches. So abortive therapies include just pain medications such as NSAIDs that decrease inflammation. And there's something called sumatriptan. So NSAIDs and sumatriptan to abort the therapy. Now the other thing you want to give them is antiemetics, because often these patients will have nausea. So if they have nausea and they want to vomit, then you give them antiemetics. Now the way we prevent these from happening, so prophylaxis, it includes lifestyle changes. So what lifestyle changes in particular? It's going to be sleep, regular meals, exercise, and avoiding triggers. So different people will have different triggers for the migraine headache, so obviously then you just avoid those. Medication or prophylaxis you can give, you get options. You have beta blockers, amitriptyline, which is a tricyclic antidepressant, or anti-epileptics, so like valproate or topiramate. So you take these medications and you make these lifestyle changes to avoid having future migraines. Next headache is called a tension headache, and the location here is bilateral. And what it is, you feel like a tension like band around your head. So that's why it's called a tension. It's like a tight squeezing of your head. Duration can be varied. It can be very short and go away quickly, or it can be chronic, so it can be weeks of constant this tightness of headache. Quality we mentioned already. It's non-pulsating. It's more like a band-like tension around your head. And the key thing is there's no associated symptoms. The treatment here again is some pain relief. So you can give them NSAIDs. You can give them acetaminophen. You can also try tricyclic antidepressants again, like amitriptyline. Now finally, we have cluster headaches. These are unilateral and usually localized to the periorbital region, so around the eyes. So it's unilateral, it's around the eyes. And I'm going to draw it actually in darker because I want to show that this is a very severe type of pain, as we'll see in a second. The duration is short. These last less than 3 hours. And the reason why they're called clusters though, cluster headaches, is because they occur in clusters. So you're going to get, like let's say in a month, you get hit by this cluster headache. It lasts for less than 3 hours, and then it comes again a few hours later, and it comes and goes for a few days. And after that, for the rest of the month, you're fine. And then maybe during 2 months later, you get another cluster of these headaches. And so the pain here is excruciating, and it's pain around the eyes, we said. And the associated symptoms include a lot of like runniness, so a lot of like watery stuff. So you can have lacrimation, so his eyes are very teary. You can have a runny nose. The other thing you can have is Horner syndrome. Do you remember what the mnemonic or what the symptoms were? Remember that was horny Pam? Remember that was P was for ptosis, A was for ptosis, was drooping of the eyelid. Again, it's related to the eye. A was anhidrosis, so there's no sweating. And M was meiosis, so pupils are very constricted. Remember, this is all due to lack of the sympathetic stimulation. So again, it's like basically very severe pain around the eye and a lot of like runny symptoms, so lacrimation and runny nose. And again, you can have abortive as well as prophylaxis treatment. So treatment for abortive symptoms include 100% O2. So that's just inhaling pure oxygen. Remember, the air is 20% O2. So if you have a cluster headache, what really helps is inhaling pure oxygen. I remember hearing a story about some guy had a lab professor who kept getting cluster headaches, and so he'd have like tanks of oxygen just lying around the lab, and he'd inhale that, and he'd be much better once he figured out that this 100% O2 helps him. Other thing that helps is sumatriptan, which is the same medication we use to abort migraines. Prophylaxis here is you can give glucocorticoids as induction, so it's just that anti-inflammatory first, and then you do that until the verapamil starts taking effect. So verapamil was a calcium channel blocker. So these are our most important causes of headaches that you want to keep in your differential. And all these things that I've told you are going to help you differentiate which is the cause of the patient's headache. So bilateral usually means it's tension, and unilateral can be either migraine or cluster. Remember that cluster usually prefers the periorbital region. And cluster and timing occurs in clusters, while migraine is usually limited to 3 days, and tension can be very, very long. And then finally, associated symptoms for migraine is very telling. Is the pulsatingness, the aura is very telling, and also the photophobia. And then for the tension headache, it's just that band-like tension, no other symptoms. And then cluster is also very telling because you have all this wateriness. So you have wateriness in the eyes and wateriness in the nose. And the treatment here, just remember that 100% O2 is very characteristic for the cluster headaches. And yeah, that's it. That's it for headaches.